everyone. You're watching We Heart Therapy, the special series EFT Talk. I'm your host, Dr. Anabelle Bugatti, licensed marriage and family therapist and certified EFT therapist and soon to be certified EFT supervisor here in fabulous Las Vegas. And I'm really delighted today to have a special guest on with us. We have Dr. Karin Wagenaar. She's actually the EFT trainer in the Netherlands. She's the first certified EFT trainer in Europe. And she runs the EFT Center in the Netherlands. And has this tremendous background in working with mental health. And so we've invited her on the show today to talk about how to use EFT with personality disorders, which is a big one. So thank you, Karin, so much for being with us today.
Thank you for inviting me. It's quite an honor, actually, to be on your show. And to be one of the, I'm not maybe the first person from outside the US, but definitely it's an honor to be on the show. Thank you.
Well, thank you. You're welcome. So Karin, I know we've heard Sue talk a lot about her idea of personality disorders. So through the EFT lens, so let's kind of discuss. I know personality disorders in general can be a very controversial topic.
Yeah.
And whether or not somebody meets the DSM criteria for a personality disorder, how would you say that EFT kind of conceptualizes personality disorders?
Well, I think the whole concept of personality disorders is a misused concept. I think people call difficult clients often, oh, that's a borderline personality disorder. But I think that a personality disorder or borderline personality disorder needs to be focused as a result of extreme insecure attachment. As I worked in a clinic where a lot of people were taken in for 9 months for a treatment, and nearly all of them had real adverse childhood experiences, lots of parental emotional unavailability and neglect, and I think it's a combination of the child temperament and the temperament of the parent that's not really easy in interaction. So when a child has a lot of negative emotionality and impulsivity, it's a hard child to raise, and some parents are not really up to the task, and then there's a lot of negative interaction going on. And I think also if there's a lot of poverty and there's a lot of other maybe depression or any other kind of illness in the parents, then there's such a strain on the parent, on the interaction between parent and child, that a lot of trauma also happens in the child's life. So I mean, it's a combination of temperament of the child, temperament of the parents, a lot of adverse experiences, and a lot of trauma. Yeah. So there's a lot of, I think there's such an overlap between trauma and personality disorders. Sometimes it's even hard to know what to focus on first. I mean, in our program in the clinic, there gradually we saw that we needed to also separate trauma work and not only group work or individual therapy, but also trauma work with these people.
Yeah, so what I hear you saying, Karin, is, and I 100% agree with you, and in fact, I'm actually writing a book about having relentless empathy with difficult and challenging clients, and personality disorders is certainly one of the, and that's exactly, the same sentiments I present in the book, is that personality disorder can be something that gets overused or misused and kind of thrown out. I especially find it common lately where people use the term narcissism when they're describing somebody who lacks empathy or focuses on their interests, or just doesn't, have a lot of, they may be really hurtful. So they may not actually meet the criteria, but, I like what you said is that, true personality disorders, can really be birthed out of a lot of environmental factors, and it could be many different factors. But from your clinical experience, you've in almost, in the majority of your clients, you've noted that there's a lot of adverse childhood experiences. And, sometimes, they may not have there may not necessarily be abuse or trauma, but, if you have a child, like you said, that already has a more intensive emotional temperament, and you have a parent that's maybe not a match, maybe their coping skills are a little more avoidant, then that can also help kind of nurture the roots of personality disorders. And really it can become an attachment trauma, which often gets overlooked. People don't tend to see that the impact of attachment trauma can be really almost more profound than physical trauma.
Right. Yeah, absolutely. And I think when it's not so much about the actual abuse, but the neglect is much more insidious. I mean, maybe a child cannot say, well, my parent really hit me, but being neglected, not being seen, not being loved for who you are, that's so insidious, and it gives you such a negative feeling about yourself. So the whole self is not developed in a good way. And when you don't feel like you are loved, how can you be in a relationship with somebody else who, you don't trust it? So one of the things that I really notice every time, and still in all the couples that I see in my private practice, is that there's such a lack of trust, and like Vonnegut, he calls it epistemic trust. That's not built in the child and in the adult. They don't trust other people as being wiser and older, and somebody you are capable of learning something from that person. So also in the therapeutic relationship, you are not trusted as somebody who can give them something that's useful, or so the therapeutic alliance is breaking off very easily, because when they see something that they think, well, this is not right, they just, because there's such a lack of trust, they say, well, you don't really like me, you hate me, so they need a kind of concrete proof of your empathy, of your love. It has to be very concrete. If you're not there for a session, for instance, because you forgot your session, which is awful, of course. I mean, nobody would like that. But then the whole trust is, yeah.
I love how you're saying that, Karin, is that, and we often see this with clients that people would diagnose as personality disordered, is that they are constantly looking for that concrete form of trust, and often they may test you as the therapist, like how much can I push you till you prove that you don't care about me, that you don't love me, that you're going to abandon me like everybody else in my life. Yeah. And you see that a lot more with folks that would probably fall under the borderline characteristics. But what I find most is when the therapist also just kind of look at a client and I do feel like it's more of a judgment rather than a clinical diagnosis. When they look at a client, say they're very borderline-y or they're narcissistic, that it's not a clinical label to help treat them. It's a judgment. Right. And when we look at a client through this lens, we lose empathy and we lose hope that they can change. Yeah. And if we hope,
it's also about our own fear of not being good enough as a therapist and not being able to help them or not being able to hold them. and to contain all the different emotions, because it's not easy. I mean, it takes, everything is a bit more difficult, being, holding the relationship, holding the working alliance, being able to come close and stay there, or being able to contain the breach or the breach in trust.
They don't do vulnerability very well, and they're more prone to kind of freaking out emotionally when something that a normal person would be bothered by but may not experience intensely. Someone more along that realm would experience that much more delicately and traumatically.
Yes.
But also, you said something important, and then I lost my train of thought, but that's okay. So, like with borderline clients, that's what I was going to say about neglect, is that I have a lot of clients that come in that don't even realize they were neglected. It's like, it was just normal for my parents to not show me love, to not be around, for me to learn things on my own. And then you find they take care of their own needs. And when they build a life around taking care of themselves, it's hard to open that umbrella to let others in under that to help take care of their needs. And that's part of what can foster narcissism, right? Is, self-focused. But if I don't know how to rely on others, I'm
it's out of fear. It's out of fear of not being able to hold it, not being able to be really important to another person. And when you open yourself up, and finally, and the other person will leave, then you're totally gone. So
that's true. And in borderline, I think, can be really hard, because you see that they really want you to be close. They're more open to letting people close, but then simultaneously, as somebody gets close, if they get too close, they get a little scared, and the trauma comes back up, and they kind of push them away. And it can be really hard to get them to trust you. So that therapeutic alliance is so strong and so powerful.
Yeah, that's right. Yeah. I had one client, I worked with her and her husband for more than a year now. So, and I was looking at my tapes this week, and there was one tape, she came in and she had her hair nicely cut, and I said, "Oh, your hair is beautiful." She was smiling, she was really happy. And so it was the first 5 minutes of the session. And after that, there was something going on. I mean, he said, "I didn't notice that your hair was done." And you could see that her face was changing, because he didn't see her hair. She felt, I'm not important. And there was a sudden shift in emotional state. And it takes only a minute or so. And from a really happy face, she was being angry. It's very interesting if you look at the tape, and I looked a few tapes after each other, and the flow in the conversation it's just like this. It's good. Then it breaks off. She's angry. And then we have to, I need to work really hard to repair between the two of them. And he's there again. She can focus on him. Then I do an enactment, or he does an enactment to her, and then she closes her eyes because it's too hard to let it in. And then she needs to close her eyes to regulate herself. And he is really good at staying with it, because he knows this is how she does it. But it's very interesting if you look at the face where she doesn't look at him, and then there's a moment of that she's in her window of tolerance. Then everything is more or less quiet, and then something else happens. Then he does something that's not right for her, or then she goes on. So that's it. It's a very, very complicated process, actually, to but I'm holding on to it. I'm sticking. I'm staying in the process for as long as I need to. And then
Yes.
gradually there's
Yeah. I love how you
an
said the
improvement.
window of tolerance, which is so pertinent to working with these types of clients. So, and circling back in EFT, so we really, we're looking for the attachment trauma that happened, whether that's neglect, adverse childhood experiences. We don't just really see these things as coming out of a malicious place, but out of a hurt place, and it's a fear and pain.
Yes.
And we're really looking for that and trying to honor that and recognize the struggle that they have between, as I think Sue once said, that a lot of it is a struggle between closeness and distance and how they manage that. And, so a lot of times you're not going to have people that come in with an official diagnosis, but I have had a lot of clients who will say, oh, well, I was reading online and my husband thinks I fit the criteria for borderline, or I think my husband's with a narcissist. And of course, I just kind of cringe on the inside because I also see other therapists saying all kinds of things like, oh, your partner's a narcissist, you should leave the relationship.
Yeah.
Oh, goodness. So what, narcissists don't deserve to be loved? That's the worst advice ever, in my opinion.
Yeah.
It's like, we got to see them as people. And I love how you're saying is that we got to tune in that with clients that we might conceptualize as personality disorders, that their window of tolerance is so much smaller, and we have to be aware of that and watch the shifts and pay attention to those.
Yeah. I think that's really important to be aware of that. The window of tolerance need to be wide enough to do some work, and at first I was not really aware of that she was not in the window, because she's a kind of reactive stage, of state that talking a lot but not herself. So it looks like she's in the window, but actually she is telling stories. So it doesn't really.
It's not very well organized.
No, or she's so into herself, and there's so much emotion. That's also a thing that I really had to learn, because when I was working with personality disorders before I did EFT, and I was so really enthusiastic about EFT. I thought I cannot not take it into the clinic, so I just did it because that was the thing that I was doing. So in the beginning, I was really focused on going to the primary emotion, but primary emotion could be so overwhelming that they didn't know what to do with it. And so I needed to take smaller steps and be really aware that if you go too much pain, that it's too big, and then they go into a flop, or into the hopelessness.
Fast. They could get
so much going on, and then the partner cannot be with them because he's a bit shocked. Oh my God, what's happening here? And then the connection between the two of them will not get made. So I work more slowly now, more delicately, every small step, and see if they're still in the window or not. So that really helps.
Yeah. So I like how it's really kind of what you're saying is that we would treat, these kinds of issues very similar to trauma. You're going to go a lot slower, and really to not go too deep, too fast, which is just good EFT work anyway, right? Yeah. But we've got to pay attention to those micro moves, especially I find. So I want to kind of talk a little bit between the difference of how these different types of clients might present, and then we'll come back to how to put that in the model. But, I think with clients that might fall under the conceptualization of borderline, will show a lot more obvious signs of trauma and disorganized attachment. And I mean, that's really, it is just, all the behavior is just so in line with disorganized attachment, right? And it's come here, but don't come too close, go away, but don't really go away, you know, and that window of tolerance can sometimes only be a hair trigger away. And where a lot of the partners don't know where that trigger is and what sets it off. And then because the, you know, other person has so much trauma, that emotion can get really big, really overwhelming. And the partner just, I have no idea what to do with all this. This doesn't make sense. Why is she so upset? This was just a little thing. Or why is he upset? But so, and then with narcissism, I mean, I know they've kind of conceptualized it into two different types, that narcissism can either fall under the anxious attachment or the avoidant, you know, but really underneath it's this fear that people, just like with borderline, I cannot rely on others securely to be there for me. I kind of call narcissism the golden parachute method, right? Since in EFT, we see as behaviors as coping strategies that people have acquired to deal with these things. So, you know, if their attachment dilemma is, I don't know how to rely on other people to be there, in narcissism, it's just that golden parachute of, I got to be there for myself to such a magnitude and that magnitude, I think, really describes the level of distrust. Right? Yeah. Is that if I really don't trust people, I have to work harder to be there for myself. And that may even include giving myself self-love, right? Like, you know, this is where you see the bigger egos. Like, I reassure myself, I tell myself how good I am, how awesome. And when you're constantly taking care of your own emotional and attachment needs, there's not a lot of room for a partner to come into that umbrella, right? And it can feel kind of off-put because they want to get in, but the other person is like, no, you got to do it my way because that's the only way I know how to feel safe.
As also a kind of controlling, of course. It needs to be done in my way, otherwise I don't feel safe enough. And so the other person cannot really give something to the other person. I had a couple, and the man was really anxious inside, and he was on the outside. He was everything what needed to be perfect. He was he worked really hard. He had a nice look. Everything was okay, but inside was so small. And when I tried to validate him for his inner fear and his feeling of being a small lonely boy, I was too fast, and he was so angry that it felt like I was almost how do you say that? It felt for him that he was too vulnerable in the face of his in the company of his wife. That I said something about his vulnerability, that he was really angry at me in such a sharp way that I was really taken aback. Oh, he needs to push me away so fast, you know, because
word I find that folks along the narcissism spectrum don't like is vulnerability. That is a dangerous word.
Dangerous. I thought, oh, I'm going too fast. I said, oh, I'm so sorry. I said something that's not really helpful for you. But he said, well, I will never come back here, and this is not safe, and I don't want to be doing this in a couple therapy. I want to have my own therapist. So he went into individual, and I think that was a real good choice. And after that, they both came to the couple sessions. So he needed to have some safe space to work on his own internal world, you know.
Yeah, and that's where that therapeutic alliance is so important. And you know, when I mentioned the anxious and the avoidant, so I'm sure some of the viewers are thinking, okay, so how does narcissism fall under those? So you have some narcissists who are pretty open about their vulnerability underneath feeling insecure, that their distress comes, like they have a good self-image, but the heart of their distress comes when their partner doesn't see them in that positive self-image. Mm-hmm. And, you know, that's where their insecurity comes. They're pretty able to recognize, I know that I need this constant validation and approval to feel worthy about myself, but I also know that I work really hard to have good skills. But then you have they call it covert narcissism, which is much more avoidant, where they really don't let people see. I kind of call it smoke and mirrors, where they kind of distract you with, you know, how awesome they think they are. So you don't really see underneath how vulnerable they're feeling. Mm-hmm. And they really don't like people to see. But if you get close enough, you'll see the cracks in the surface to the insecurity underneath. And they're really just looking to be loved like anyone else, but they don't know how to let anyone else come close and meet that need for them. So yeah, they may tell themselves, I love you, you're the greatest person in the world, to themselves, because I don't trust my partner to come and be with me and tell me that I'm great. You know, and if I open myself up vulnerably, I could become reliant on needing that or wanting it from a partner who may never give it to me. And that's too scary, right? Yeah, very scary. And part of that empathy goes out is when you avoid, and you find this with a lot of avoiders, is they tend to numb out a lot of emotions. And when you're numb, you can't experience empathy because you have to be like an emotionally resonant chamber to have empathy. And if there's no emotion flowing through, there's no way you can feel empathy. But it's not from malice, you know?
Yeah, no, absolutely not from malice. No, yeah, right. Yeah, you say it beautifully. Yeah.
Thank you. So Karin, tell us how, okay, so we have clients that come in and they're telling you right off the bat, well, you know, they're throwing out these words, my husband's a narcissist, or, you know, I think I might fit borderline personality disorder. How would you handle that as an EFTer in session?
Yeah. Well, I have hardly any people who come in saying, I think I'm a borderline personality disorder. When they come in, most of them, they have a diagnosis. So they went to all these other therapies, or they went to a clinic and they were treated for the personality disorder, and now they want to come in with their partner because they feel it's very, very difficult to be in a relationship. So I'm not the one most of the time who does the diagnostic interview. That has been done by somebody else, by a psychiatrist, for instance. So for me, that's kind of cool, actually, when they know this is who I am and I have this vulnerability, and it's not because somebody said it out of a reaction to, but it's the truth. I mean, this is what it is.
Yeah.
So then we start working, and I say, well, I see it as a particular vulnerability in the way you relate to other people, and you relate to yourself, and you relate to in the way you relate to the world. I mean, it's not nice to be so sensitive. It's a kind of a interpersonal sensitivity that's really hard to live with. So how shall we see it in this light? You know, there's a kind of sensitivity, and that you take that into your relationship, and your partner probably has a problem with it because, there's small things can really lead to a big escalation, and that impacts your relationship and the safety, and you're afraid of your partner leaving you. And so let's look at your pattern. And most of them know what EFT is. So they come in because they know that I'm an EFT therapist. So that's kind of clear from the beginning, actually. And
let's suppose that they don't know, and I'm wondering if some of this might be an American thing, because I do know, even in my own experience, I've had a couple clients come in and they like to read these pop psychology articles online. It says 5 signs you might be borderline, whatever. So they come in and they say, oh, I think that I fit this.
Okay.
Sometimes they're open about it, and sometimes they just use it as a way to sort of hurt their partner. But I also see therapists on Facebook who will say, you know, what do you do if one of your clients exhibits narcissistic traits or, you know, borderline traits, which again tells me that they're sort of going to the pathological side and not really seeing the person and the insecurities and the trauma underneath.
Yeah.
So what can you speak to on that for therapists who are sitting there thinking, I wonder if this is a personality disorder?
Yeah. Well, I'm not so fond of say, well, you're probably this, you're probably that. I mean, I say, well, okay, if you think your partner is a borderline personality, has a personality disorder, let's see how that plays out in your relationship. I mean, I'm not really looking for diagnoses. I'm looking for people who want to understand how they are and how they impact each other in the relationship. So for me, it's about attachment behavior, about pain, about being loved, not being able to love another person. So I hardly ever talk about the personality disorder at all. I mean, yeah, they come in and they say, this is who I am, here's my diagnosis. Okay, well, we'll work with it. But I hardly talk about it, actually.
Yeah, and I love it because, you know, and I know that Sue would absolutely agree, because again, EFT takes a non-pathological stance, and as EFT therapists, that's what our go-to strategy should be, is to look at the attachment distress, that these behaviors are just the coping strategies.
Right. That's
And
what you work with, and it's not interesting at all, I think, to know what name it has. Sometimes you need to know the name because for them to know what their sensitivity is, and that it's not something that's bad, but it's something they need to live with. They have not asked to be this way. I mean, they have not asked to have these parents. So life treated them in a horrible way, you know, like the person I was talking about, that I see for more than a year now. She had a horrible childhood, and I think she did a marvelous job actually being the person she is now. I mean, with all her sensitivities, but she did a great job, you know, actually seeing what she already has succeeded in life. I mean, yeah. And I try to help her get a better life with her partner.
yeah, I love that. So you're really saying, be with the person and understand their attachment dilemma and their pain, and focus less on a diagnosis, and, you know, kind of stop pathologizing them, and look at, you know, through the attachment lens, what you're looking at. Understand that the behavior is a sign of pain and trauma, and look at that.
Yeah. And it's funny because this lady came in and she said, I think my husband, so she had the diagnosis, and she said, well, I think he is autistic. He's on the spectrum. I said, okay, yeah, well, could be. I mean, why do you think he's on the spectrum? I don't know what you mean exactly, but on the spec, I know what she means, but I don't want to step into the whole thing, you know. Because sometimes she said, well, he's not really sensitive, and he doesn't know what I mean when I have all these emotions. And it turns out that he's so overwhelmed by all her emotions that he needs time for himself to figure it out, to sort it out, and to feel, where's my space? There's hardly any room for my thoughts or for my feelings. So he shut his thing off. You know, it's more like a withdrawal actually than on the spectrum. And now that I work with him for a while, he's not on the spectrum. He was overwhelmed. He was anxious. He was just moving away from the intensity. Yeah.
And that happens. And so often when we see one partner shut down, that can be, you know, seen by the partner, whether they're personality disorder or not. You just find this very common in therapy, is when one person feels overwhelmed by the emotions, they may shut down. And when they shut down, they're not available emotionally, they're not present, and it's hard to be responsive to their partner. And that lack of responsiveness leaves their partner feeling not cared for, not seen oftentimes.
And not loved. Yeah. And then that's the moment that she says, well, I think we can't have a relationship. We need to break off because you make me so miserable. And actually, he's trying to do some work, on his own company, and he's trying to spend some time with his sons, or so there's nothing really happening. But for her, it feels like a total abandonment. I'm not important. So, and then when she says, I think I'll break it off. I mean, this happened in the last year. I think we had 5 moments that she said that she emailed me and saying, well, I broke off the relationship. So can I have a session alone? I said, I don't think so. I have no time in between. Our conjoined session is done, and then I will see you then. And then they both came. Yeah. So I'm not stepping into that.
Yeah.
Thing.
You don't step into that, getting into diagnosing each other and just throwing those labels about, but understanding what the attachment significance is there. That, when I'm seen, I don't feel loved. Again, because all this comes back to feeling loved in some way. That's always at the base.
Yes.
And so through this, if we're in stage 1, we're working on helping them send clear emotional signals, right? So the person who's, might be really reactive and has that hair trigger kind of trauma responses, we're going to help them organize that and turn to their partner and say, right here, I get scared, right? I show it, I get really angry really fast, but really what that's about is me getting scared that maybe you don't love me, right?
Yeah.
And that would be a new signal that would help change the dance, because that's not what their partner sees. They don't see their partner as scared. They see them as angry and, nitpicking. Or Yeah. So that's really beautiful and it's really important. And I love, that the focus just, you keep bringing it back as a clinician to how they feel loved. And that's really the heart of the insecurity, is not being loved. Yeah. So can you also help? So I know, especially with, clients that are more turned away, more on the avoidance side, personality disorder or not, can you help? I know a lot of them in session will say, well, why do I need to be vulnerable? Why do I need to talk to my partner about my emotions? What's the big deal? Being emotional is not good, right? Mm-hmm. So how would you sort of address that in session?
So then we're talking about another kind of client that's more on the withdrawn side, avoidance side.
Like, narcissists that struggle with vulnerability, like, if I do such a good job of taking care of it on my own and it works just fine for me, why do I need to open up and start relying on my partner? Why is it so terrible to rely on?
In the clinic where I work, we had 2 departments. One was the more borderline externalizing kind of problems, and the other was internalizing, so more the avoidant. And narcissistic was not so much part of the clientele there, so that it's not, I have not so much experience with the narcissist, but with the avoidant, these people were so used to being on their own, but felt so lonely inside. I felt so not seen, not important, insecure, not being able to step out in the world and say, well, this is who I am and this is what I can do. If they were in a relationship, and most of them weren't, then the partner had a real hard time showing their love to this person. You know, so they really wanted to be there for them, but the client, so to speak, was not able to take it in, and so there was nobody on the dance floor actually. So, and that also felt really, really sad and lonely and empty inside. So when you want to help them to get a more connected relationship because they feel so lonely, you need to help them to come out of their shell, you know. So to say, well, if your partner wants to be there for you and you are not able to receive that, then there will be no, you will never feel that you're loved. So I'm really interested in your inner world, you know. So I think the first step is that you as a therapist says, it's hard for you to open up, but I'm here and I want to know all about you. I'm very curious to know who you are. So this is, I think, that you model for the client that there's somebody who has the time and the interest and the curiosity and the empathy to be there for them. How long it will take to actually, how long it will need. Maybe we have to do this for very small steps every time. But I'm here. You can talk to me. So in the group therapy, it was a lot of silence, you know, because we had 9 of these clients together in the group, and nobody was talking because they all felt, I'm not important, you know, and I can't trust that you are really interested in me. So it was a very slow process. Mm-hmm. But I think being very transparent and very interested, like a good mother actually, and every small sliver they give you, you validate and you say, oh, this is wonderful, and this is the first step you took to say something about your insecurity or about your sadness, or about, I mean, you validate the hell out of them, you know. So
yeah, and I like that, because even sometimes you'll have the clients, one of the hallmark things they'll say is, but yeah, I just got used to that, right? They're used to nobody responding, and they learned to live without it.
Yeah.
And
how sad is that? I mean,
yeah,
horrible.
Yeah, and they don't see it as horrible because it's just normal in their world, right? And that's, you know, where a lot of that neglect shows up, is that, you know, I'm used to it, it doesn't bother me anymore, you know, because they've adapted. So that adaptive strategy is to avoid needing it because they never had it and couldn't rely on it. So you're really asking them to open up their world, their trust, their vulnerability, and risk allowing that to be a possibility and wanting and depending on that again, which is kind of like what a deep stage 2 would look like. You know, when you're talking about seeing yourself as a person with needs, that's step 5. Mm-hmm. And allowing yourself to tap into those needs again and desire them and rely on somebody else emotionally. That's really risky for somebody that's never had that before.
Yeah. And actually, if they open up, first they cannot really trust that it's really true, and then all of a sudden they start to feel, it's so sad that I have never had this before, and then there's a whole sadness that's so overwhelmingly big. I mean, and then the anger comes, you know, why didn't I have this? And so the whole assertiveness about, I'm a person too, and I want to, I want to be guided, I want to be nourished as well. But that's a later thing in the process, of course. Yeah.
And I think one of the biggest struggles right in that place is making that first contact, where they are very hesitant to see themselves as having needs. It's like, well, I lived with it for so long. I've learned to be successful and live just fine without it. Why do you want to shake up my world in this way? Yeah. And they have a lot of pushback. I don't want to do that. I don't need to do that. Right? because I learned to live without it. And now you're threatening my survival again.
Yeah. That's true. And I think when I'm thinking about animals, sometimes the only person they have is their dog or their cat, and the closeness or the love or the affection that they feel for their animal. I mean, it's a start. That this is about affection. This is about warmth. This is about also like a bodily experience to have something warm on your body, like a cat or a dog. I think also when people have no language because they are so used to being silent, the body is a good entrance, to start to feel something. And so sometimes you need to work with the body more than in people who have more language.
Yes. Even that I found can be a struggle for the clients that have been neglected or compartmentalized in their head, is that when you first try to ground them in their emotions in their body, you can still sense that they're talking about their emotions from their head space. And they're like, why do I don't know what my body feels? Why is that important? I want it to help you feel your emotions to get into them. And yes, there will probably be some pain that comes up, but also to have joy and elation, and passion, all those things that also help relationships and attachment bonds abide over time, right?
Yes.
Being able to feel happiness more deeply.
Yeah, that's true. Because when one emotion is pushed down, all the other emotions are pushed down too. So that if you don't want to feel your sadness, then there's also no joy. You're right. Yeah. No playfulness.
Yeah. That's right. So this is really beautiful, Karin. So I love just that really big emphasis in attachment in EFT on being with the person, not a diagnostic label.
No.
And be careful that we're not using it as a judgment, especially if, these are not labels that people are using as a way to help a client. They become a way to label them as challenging or difficult.
And push it away.
Which doesn't serve the client, and it doesn't serve the therapist. And so when we can be with them and recognize their attachment dilemma, then it's so much easier to have empathy for them, because at the end of the day, they're just wanting to be loved. Right. And the disorder conceptually is just the behaviors, the adaptive strategies that they've adapted to cope with not feeling loved.
Yeah, and with abnormal situations where they have grown in, where they have been in as a child. Yeah,
absolutely. So Karin, let's talk a little bit more about you. So do you offer training? Do you have writings on personality disorders and EFT? Where can people learn from you?
Yeah, well, I'm most of my trainings, of course, are in Dutch, because I do a 2-day workshop with about EFT and personality problems, personality disorders. I'll do it in English in Ireland now, and in Romania, and in Naples on the EFTA conference. And I wrote a book in Dutch about relationships, but that's in Dutch, of course. It's actually translated into Hungarian, so that's really nice. I do all kinds of trainings, not only on personality disorders. And we also are in the middle of organizing our 5th EFT conference in the Netherlands. It's about EFT in the body. We're doing all kinds of stuff, Yeah.
If folks want to fly you out to the States to do a training, they can contact you and get something scheduled?
Yes, if they think it's interesting, it would be lovely. I've lived in the States for years, so I love the people, and I would really love to do something. Yeah.
Excellent. Now, do you have a website? How can people find you?
I have a website. It's Wagenaar Psychotherapy. And you can find some stuff over there and on the website, and you could also go to www.eft.nl. That's the website of our Dutch EFT Foundation, and there's information on the website about all the trainings we do in Holland, and on, maybe ICEEFT website. I don't know if, I'm on the website there too, so you can find my my name and my number.
And you have any email so that folks can email you?
Yeah, karin.wagenaar@gmail.com.
Okay, perfect. And I'm going to put, because you have the beautiful, beautiful accent, but it can be hard to understand how to spell something that's in an accent. So I will put the link to your website and your email address in the description for this video on YouTube. Guys, Karin is just absolutely lovely, and she's a tremendous leader, an EFT trainer, doing amazing things in Netherlands, and just did a training at the International School in London. So if you guys haven't gotten a chance to attend a training there, make sure you look them up. And she's going to be planning the next EFT Summit in Netherlands, in Amsterdam.
That's true.
So we're going to look forward to information about that. And as I said, I'm going to put the links to Karin's websites in the description for this video. So guys, please email Karin if you have any questions, if you want to have her come out for a training. That will be really excellent. Mm-hmm. And I just want to say thank you again to all of our viewers. And just make sure that you hit subscribe, because more videos are on the way.